Welcome back to another episode with Mirta Precision Health Podcast. My name is Mirta, and in this podcast, I bring research to your home so you can make educated decisions and choices to upgrade your health from a scientific perspective, so you can become empowered to take control of your health rather than wait until it's too late and you already have a full-blown problem. Now, today's podcast episode is on thyroid hormones and in particular, thyroid labs. Now, chances are that you have gone and had some blood work done at your GP or your annual checkup, and you've had your thyroid hormones tested, or at least one of the main ones that often gets tested, called TSH. And chances are that your doctor said everything's fine, no problem. Now, today I will be talking a little bit more about what other markers you might be wanting to look at when it comes to thyroid health, and also whether, even if you look at these different other thyroid markers, even though they might be in normal ranges, they could already be contributing to issues. Now, let's go into all of that in a little bit more detail. But before I do that, I want to just have a quick review of what are the different thyroid hormones, so that we then know what we're actually talking about when we're talking about the measures. Now, we have in our brain, we send something called thyroid stimulating hormone to our thyroid gland, where we then produce a precursor thyroid hormone called T4. That T4 then gets converted into the actual thyroid hormone T3, mostly in the periphery, so in other organs where they actually then action. Now, that is important, so keep in mind there's thyroid stimulating hormone, short TSH, then there's free T4, which is the precursor hormone mostly, and then there's free T3, which is the mostly active thyroid hormone. So there's also non-free T4 and 3, but they are mostly bound, so they don't really action in the body. They're bound by other substances and protein. So we will be looking at the free versions that are floating around in the bloodstream that can actually do something in the body, that have actions. Now, what do thyroid hormones usually do? A lot of people relate thyroid hormones to our weight, and for good reason, because thyroid hormones are basically our main metabolism hormones. They help produce energy, they ramp up our metabolism and make us burn calories quicker, produce energy. But thyroid hormones are also important for our cardiovascular health. If our thyroids are out of balance, then it can contribute to high cholesterol levels. Thyroid hormones are important for our mood and our brain health. If we don't have the right amounts, it can cause anxiety or depression. Thyroid hormones also are important for bone health. It's also important for fertility, so oftentimes that's an overlooked factor when people have trouble conceiving, because thyroid hormones affect our sex hormones like estrogen, progesterone, but also egg count, that AMH that people often refer to, our ovarian reserve. And thyroid hormones, if they're sluggish, they can also cause common symptoms such as weight gain. We often know that one, but also hair loss, but also problems with being more sensitive to cold and just getting cold quicker. And also, if the thyroid hormones are overactive, that can cause excessive sweating, it can cause heart palpitations, and it can also sometimes cause that bulging of the eyes you might be familiar with your friends, or maybe you experience that yourself. The thyroid hormone is also very important for growth, not just for metabolism, and it actually passes to the fetus while the babies are growing inside the mother's womb. And if there isn't enough thyroid during pregnancy, not only makes it harder to conceive and keep the pregnancy, it also might, if you actually manage to have a baby, to kind of retard the growth of the baby and can contribute to cognitive problems down the line for that child. So it's really important to keep measuring the thyroid, in particular if you are aiming to conceive and while you're pregnant. Now, even though, and I just mentioned that in the beginning, even though you might have measured your thyroid, most likely you have had the TSH measured. That's the most commonly measured thyroid marker in blood. That isn't usually enough. Now, they used to think that TSH, that thyroid stimulating hormone, is a very good marker for overall thyroid health, because they thought that there was a set point where our body just has a certain predisposition for thyroid hormones, and if that TSH kind of goes up or down, it will show us if there's a problem somewhere down the line. Because there is something called a feed-forward mechanism. When we don't have enough thyroid hormones, technically speaking, our brain should start to stimulate more production. And if there's a lot of thyroid hormones, then technically speaking, if everything goes well, our brain should stop signaling and reduce that stimulating hormone. And that actually works if our thyroid and everything in the body is functioning. But they found that if there are other factors such as inflammation, circadian rhythm disruptions, not enough food or too much food, that can actually mess with that signaling. And in particular, also if there are thyroid antibodies, when there's an autoimmune component where the immune system is starting to attack our thyroid gland, then that whole signaling cascade might actually be skewed. And then you might have a normal TSH level, but actually your thyroid hormones might be not optimal. Now, research found that even if you have had your thyroid hormones tested, your TSH, and that is in the normal range, then even if let's say you're in the normal range, it could potentially be that if you're in the top part of that TSH, it could already contribute to health issues somewhere else. So if you are, let's say, thyroid TSH is normal, there's a high chance that if you have symptoms that sound like thyroid problems, that you actually have potentially a low T3 level. In particular, if you have thyroid autoimmune antibodies present already. Now, oftentimes doctors don't test for free T3 or thyroid antibodies for financial reasons, and also because of what I said before, that they thought that it wasn't actually necessary, that TSH would tell us everything. But they found that the TSH often can be normal and there could be issues, low T3, thyroid antibodies already messing with our symptoms, with our body and causing symptoms. Now, what they also found is that if we have normal thyroid stimulating hormone, but there are thyroid antibodies present and they haven't been tested sometimes, that there's a higher chance and a higher risk of developing thyroid issues down the line. So if we want to be more proactive, it would be great to know what's going on, even if there isn't currently a problem, but to be more proactive and prevent things from happening. Because usually how it works in the body, once something's already fully out of line and the system has stopped working, it's harder to get it back on track. It's much easier to stop it when it's starting to slip away into that wrong, faulty mechanism and bring it back to optimal functioning long before it actually turns into a problem. Now, the markers you would like to get your GP to test, if possible, or maybe you go and find a private place where you can get those markers tested if you think that your thyroid might be causing symptoms, or also if you just wanted to be proactive. So you don't have to have symptoms to test these things. I always think it's best to just get a good screen of everything, because sometimes we don't have symptoms, or we're just a little bit tired, or we have these niggly little things that we're not really aware of where they could be coming from, and then we become much more empowered and proactive about our health choices. Now, the other markers that you would want to add to get a better understanding of what's happening with your thyroid, you can probably now already think and guess that are, so we want to have TSH, that's usually tested, but then we want to add free T4, which also commonly gets tested now, even with the NHS, they often add that. But then you want to make a point of also testing free T3 and thyroid antibodies. In particular, TPO, that's a type of antibody where the immune system attacks our own thyroid. Now, reason being is, I briefly mentioned it before, but there is research that shows that TSH can be in normal ranges, free T4 can be in normal ranges, but the actual active thyroid hormone that we need to do its job might be on the low end of the range and contributing to symptoms like a sluggish metabolism, cholesterol starting to creep up, energy levels dropping, weight starting to creep up, insulin starting to, the blood sugar signaling not working as well. So we do want to measure our T3. And then we also, like I said before, want to measure the thyroid antibodies, because research shows that even if TSH is normal, even if free T4 is normal, they call that euthyroid in research, when we're technically having normal thyroid levels, that if there are autoantibodies present, these thyroid antibodies, then there's a higher likelihood of having issues with the thyroid down the line, but also other problems. So thyroid antibodies have been linked to also non-thyroid related issues such as problems with fertility, lowering our ovarian reserve. It also has been linked to a higher risk of atherosclerosis, so problems with our cardiovascular system, that which if that continues, there's plaque buildup that can cause strokes and heart attacks, those kinds of things. And also it has been linked to a higher risk of breast cancer development. So all these things we really don't want. Now they think that just the pure presence of thyroid antibodies or any kind of antibodies really makes our body a little bit more inflamed, which contributes to all these inflammatory health conditions like cancers, like atherosclerosis, where our the endothelial lining inside our cardiovascular system starts to get broken down from that inflammation. So it's no surprise in a way that these thyroid antibodies would also contribute to that. Now, on the flip side, if someone already has cancer, in particular breast cancer, if they have thyroid antibodies present, they actually found that they have a better chance of survival. Likely because our immune system, if there's an overreaction, an autoimmune component where our immune system is overreactive, attacks our cells, it also helps to fight off cancer cells. But that overreactivity initially causes inflammation that contributes to the development in the first place. So it's kind of a double-edged sword, and ideally you want to prevent things, right? So my approach is always try and prevent things. And then if something's already there, then we might have to tweak the approach slightly. Similar to something called autophagy, that is a kind of a cellular cleanup, that also is a double-edged sword. When we are still healthy from an anti-aging and longevity perspective, we want to do some fasting and some other strategy that ramp up that autophagy that helps to clear off damaged cells. But if we already have an issue like cancer, we might actually have to be a little bit more careful, because that could, once there is an issue, it could potentially cause issues. So there's always this kind of slightly different strategy to be proactive and prevention. And then if there's a full-blown disease, you might have to tweak your strategy slightly with a healthcare practitioner that knows how to do it. Now, back to thyroid hormones. We talked about the importance of having a better understanding of what's actually going on, not just measuring the thyroid stimulating hormone, but also what's going on the tissue level. Do we have free T3, and do we have thyroid antibodies, and what are the levels? Now, the next step is to then also look at what are the actual levels, because I've talked about this in other videos, but the reference range that most labs use is actually not it's not created as a reference range for optimally healthy people, but it is created from an average of the population. So that also includes people that maybe where you don't want to compare yourself to, meaning that a lot of these blood results and other test results that we get, they might be there could be a range like that, but let's say that could be the optimal range, and anything on the either side might already be contributing to mini damage to our cells, inflammation, that kind of rusting and sludge building up inside the body. Not a problem if that is for a couple of weeks or few months. If that contributes and it continues for years and sometimes decades, and then other factors are also suboptimal, and just you have to think about the body like a cogwheel machinery of health. If everything works smoothly, everything runs smoothly. If something starts to not work so well because it's a little rusty, it has a knock-on effect on everything. And if that little bit of that rust continues for decades, all of a sudden everything grinds to a halt. Now, so you can think about it in a similar way with blood markers and predictive biomarkers. We want them to be optimal so that everything runs super smooth inside the body and there's no decline. And we can measure them. So for thyroid hormones in particular, they found that even though the normal range of TSH, let's go through the different ones, the normal range of TSH, depending on the lab, they're usually a little bit different from lab to lab, but in general, it's something around 0.35 to a 5.5, plus minus depending on the lab. Now, they found that for young people below 60, 70 years old, there's not a defined cutoff, but let's say average population, young middle-aged adults, the optimal range likely is somewhere between 0.5 and 2.1. So that's quite different. 0.35 to 5.5 or 0.5 to 2.1. Now they found that in the population that has quote unquote normal TSH, but some above 2.1, above 2.5, depending on what paper you're looking at, there's already a higher risk of cardiovascular disease, of atherosclerosis, of metabolic problems. So our metabolism slowing down, our gaining weight, from that then having a knock-on effect on problems with our blood sugar monitoring and signaling, insulin resistance, weight gain, mood problems. So all these things that we associate with thyroid issues are actually already starting at a TSH much lower than the normal range. Now, what they found, though, interestingly, is that as we get older, that TSH shouldn't actually be that low anymore either. So when we're young, the average of the most people that are healthy have an mean TSH of around 1.5. So that is and also when I look at labs of my patients, that's quite a common range for anyone that feels good. Now, that's something to aim for when we're young. But as we get older at age 60, 70, and then into the proper older ages, they found that actually we want to have a TSH that is slightly higher towards that 2.1. I will put a link below of the exact ranges, the optimal ranges for all the different thyroid markers, so you can read them and you can look them up and check what yours are. But basically, instead of it being 0.5 to 2.1, we want it to be around 1.8 to 2.1. That's obviously very narrow, so it's fine to be a little bit off that, but just to aim towards that. Reason being is that they found that when we get older, our heart might not be able to respond to thyroid hormones as well. So if we have too much of it, it can actually cause arrhythmias and palpitations and issues with our heart. Sorry, mini correction. So TSH, as we get older, we actually want that to be between 1.9 and 2.5. But again, I will link a whole blog post below where I'm going into all of that in detail, and you can also find all the research sources, the actual scientific papers to back all these things up. Now, reason also is that they found that centenarians, those people that are living an extremely long life, they seem to have a TSH that is a little bit, not high, but on the higher end of that optimal range rather than on the low end of it. So there seems to be a correlation that we don't actually, as we get older, we don't want to have too much of that TSH floating, too little and not too much of it floating around. Now, linked to that is that free T4, that hormone that's being stimulated by TSH, as produced by the thyroid, but that's kind of a precursor. That's actually also got quite a narrow range of what is optimal for us. Now, and I'm going to be talking about European and UK ranges here called p-mol per liter for free T4. The US has a slightly different one. Depending on the country, you might have a different one, but you can just convert it. Again, I'll put that in the link below in my blog post. But a normal range of free T4 would be anywhere between 11 and 22, depending on the lab you use. But optimally, we want that to be between 13.5 and 19.2 as a younger or middle-aged adult. And if we're older, similar to TSH, that actually becomes narrower, that range. We want that to be below 13.5 and 14.8 p-mol per liter. Now, similar reasoning is that as we're younger, we can deal with a little bit more of that thyroid hormone stimulation, and it can rev up our metabolism, and our body can handle it and can deal with it. But as we get older, too much of it has actually been linked to a higher risk of mortality, of heart problems, of free radical damage, and all sorts of lowered health expectancies. So again, not always more is a good thing. You have to be a little careful. I see this quite often in my patients or when I talk to friends and people in the public. People often think, if something's good, then more must be better, but that is not quite the case. So just be wary of that. In particular, because a lot of people that have any kind of thyroid issues, they get put on synthetic T4. So that's the normal thyroid hormone replacement medication. And you might know some of your friends, your mother, people in your environment that are on it. It's actually quite commonly prescribed. And in young people, that T4 often helps to bring the T4 into a good range. It helps to TSH to drop down into the optimal range. And it also can often be converted into the T3 that is needed to actually action and do the things in the body that the thyroid hormones are meant to be doing. Now, they found that when people get older, they might not respond to that synthetic T4 hormone replacement that well anymore. And that can often be because the conversion of T4 to T3 can start to decline. The similar thing happens with people that have thyroid antibodies. They get put on T4 and might just not reap the same benefits as someone else. While a lot of people feel much better on T4 replacement therapy, some people don't. And then it makes sense to look at free T3, what's actually ending up in the actual active thyroid hormone. And what is happening to our autoimmune component? Is that blocking our thyroid to do its job? Now, reason also is as we get older and if we're still on the same thyroid replacement hormone, the T4, then as I said before, the reference range, the optimal range becomes lower. So we might have felt good on that T4 before, but then as we get older, if we stay pumping up the T4 to a high level, but the body can't convert it into T3 as well anymore, then actually that added T4 can contribute to problems in our heart, in our all-cause mortality. So just something to be aware of as we get older in particular. And I see patients in their 60s and they've been on thyroid hormones for 20 years. And maybe now it's time to reconsider and look at other factors. Obviously, with functional medicine, it's not for today's podcast, for another one, I'll promise, is to look at why is the body not producing the right amount of thyroid hormones? What's blocking the conversion of T4 into T3? Those kinds of things is obviously how we with functional medicine would look at it from a more holistic level, from a root cause perspective. I'll try and make a podcast on that at a different stage. Today, we'll just focus on the actual levels and what they mean. But that's always the ideal version, is to say, okay, rather than just throwing hormones in there or potentially short-term have the hormones to kind of help people as a crutch, but then fix the underlying factors. Okay, so while free T4, we want that to be in quite a narrow range optimally, and that range gets a little bit narrower and lower as we get older. It's not the same for the free T3, the active thyroid hormone. Research shows that we actually want free T3, and it helps us with longevity, it helps us prevent illness, it helps us prevent decline, all-cause mortality. It helps our mitochondria become recycled. The mitochondria are those little energy-producing kind of engines inside our cells that are really important, and they start to get sluggish and produce more quote-unquote smoke as we get older, as we burn and produce energy. Now, if we have a higher level of free T3, they found that those mitochondria are more able to be recycled, killed off the ones that shouldn't be there, something called mitophagy. So we recycle the damaged ones and we have space for new and fresh ones that function better, which is then also linked to increased energy, but also increased muscle density, bone density, muscle strength, performance, mental health. So overall, actually very good. It's been linked to reduced all-cause mortality. And like I said before, increased longevity. So it's slightly different. So what research suggests is that potentially as we get older or as we get sicker, there might actually be an issue with that conversion of free T4 to T3. And like I said, I'll talk about that in a functional medicine approach to that in a different podcast. But yeah, keep that in mind. So we actually want that T3 to be high on the higher end of the range, while we want to make sure that the TSH is in a narrow range and the free T4 is in a narrow range. Now, too much of T3 is also not a good thing. So it still should be in the normal range, but on the higher end of that normal range. Okay, lastly, thyroid autoantibodies. The one I particularly want to talk about is anti-TPO. So that's a type of antibody commonly linked to Hashimoto's thyroiditis, thyroid inflammation due to autoimmune problems, but it has also been shown to be present in other autoimmune conditions and other health conditions, just at a different level. Now, I talked about the issues related to having these thyroid antibodies present earlier, and now at this point I want to talk about how the levels of optimal might be different to optimal, suboptimal. Now, while most labs say that anything below 35 plus minus of these TPO antibodies is okay, there's actually research that shows that anything above plus minus 14.5 could already contribute to problems, inflammatory issues such as, like I mentioned before, atherosclerosis, where our endothelial lining in the cardiovascular system becomes all inflamed, which can contribute to plaque build, to blood pressure issues, strokes, heart attacks, those sorts of things. But it also is linked to carcinogenesis. Now, there's even a research paper that says, no, we shouldn't be having any antithyroid antibodies because any of them contribute to low-grade inflammation, which is linked to all these bad health effects. But that's maybe a little extreme. There's quite a lot of people that have thyroid antibodies. I personally, with all the patients I've seen, hundreds and hundreds of blood work, I would say that pretty much everyone has thyroid antibodies from what I've seen. Some have none, but it's very, very rare. So I wouldn't want to freak people out. I would say let's stick to the research that says anything below 14.5 is kind of normal and safe, but anything above that, it already starts to cause inflammation and trigger problems. But there's more research needed on that end. What is really, truly optimal? Is it okay to have any kind of thyroid antibodies, even though a large proportion of the population has it? But I would rather you not freak out and stick to ranges that are that can help you be proactive without being scary and just not realistic in the end either. So I rather stick to those optimal ranges that are realistic and can help you make good choices and not worry you too much, because stress in itself is also a pro-aging substance. It makes us more inflamed in the long run. Short run, stress makes us less inflamed, but in the long run, stress actually increases inflammation, increases damage to our brain, to our heart, to everything that we really know about. So long-term stressors, stressing too much about our health when maybe it's not even possible, also not a good thing. So let's stick to the optimal ranges that are achievable, where we feel empowered and we can make changes that are good for us rather than stressing about it. Now, lastly for today, I want to touch upon a topic that I have commonly heard also in research. I've read about it. I've heard it with different thyroid doctors and specialists, but then also patients have addressed me about it. So they used to think that we have a set point for our thyroid. That we just have, from birth, we have a certain amount of thyroid hormones that is our kind of where we are, our gauge, and there's not really much we can do about it to change it. Now, the recent research actually shows that that might not be quite the truth, even though we might genetically be a little bit more prone to a sluggish thyroid or more prone to a quicker thyroid and also more prone to maybe thyroid autoimmune problems. Our lifestyle very much dictates whether that we can upregulate and downregulate that. And some of the factors include things like inflammation, how much we eat, if we eat too much, if we eat too little, if we have chronic infections that cause that inflammation, if we have hidden food intolerances that constantly cause inflammation and then mess with our autoimmune system and make the body more autoimmune. But then also things like our circadian rhythm. So what time of the day we're doing certain things, how we live, how we sleep, they are all linked to that as well. So while we used to think that the thyroid is just something that we get from birth, and there is some truth to that, there is a lot we can influence with our lifestyle and our changing things in our environment, but also inside our biology to make things work smoother and prevent and optimize that. And obviously with functional medicine, that's where we come in. We test these things and we don't just look at, let's say, free T3 and free T4 and then throw in some thyroid hormones, even though, like I said, as a crutch, no problem. However, functional medicine then will take it one level deeper and say, why is this happening? Where is this? Why is this not being converted? Why isn't the brain sending the right signals? Why isn't the gland making the right kind of hormones, and why don't we have enough at the end? So that would be the functional medicine approach, so that you don't have to rely on thyroid hormones for the rest of your life. And as I said before, oftentimes we throw in thyroid hormones, but eventually as we get older, they stop working as well and actually maybe cause problems. And also we might throw in thyroid hormones not knowing that there is a component of thyroid autoantibodies because we might have just never tested for it. And then those thyroid antibodies go unnoticed and cause issues in other bodily tissues. So I always think it's good to just get a deeper dive, look at where are things coming from, why are things happening, so that you can really become very proactive and can make educated choices while still living a little and obviously having some fun. Now, I hope you found that helpful. I would love to hear from you. If you have questions, if you have comments, if you would like for me to elaborate on certain things. And as always, have a wonderful time, and I hope you take that information and become empowered to take care of your health.